Hello and welcome. Today we're going to be talking about how the use of antihistamines can be very helpful in the treatment of chronic parasitic infections in multiple sclerosis. If we haven't met yet, my name is Pam Bartha and I am the author of Become a Wellness Champion and the founder of Live Disease Free. And I am very happy to spend this time with you. We are breaking ground, learning new things that will really help us to recover from these chronic silent infections that are not only causing multiple sclerosis, but all chronic disease. So if you've been following me for a while, I have a lot of wonderful videos that are on YouTube and on Facebook. So our channel is Live Disease Free. And I just want to make sure you guys can hear me. Just let me know that you can hear me. I think you can. Awesome. So if you've been following my work, great. And what I would love for you to do while you're with me during this time is please put down your comments, your questions, and also please send some love, thumbs up, hearts, and share this information with other people that are searching for answers to recover, not just for multiple sclerosis, but for any type of chronic disease. So if we haven't met yet, my name is Pam Bartha, and 29 years ago, I was diagnosed with multiple sclerosis. And I'm happy to share with you that very early on, I learned that MS is caused by chronic infections. And so I took a different path. I decided, because I was not given any hope, I basically was told I was going to end up completely disabled in time. And I really didn't like that. And I was very fortunate to get some information written by a medically trained doctor talking about how infections in the body are causing not just MS, but all chronic disease. So I took that different path, and all I can share with you is I've had an amazing life. I had another child. I went back to university, got a science degree. I'm a very avid researcher, and I've had the amazing privilege to coach hundreds of people in helping them to recover from chronic disease. This has been a milestone year for us. We have learned so much, and what I'm going to share with you today is a golden nugget. So if you've been following my different videos, you will know that I teach that MS is caused by infection, and I'm not the brainchild behind all of this. This has been known for 30 years. It's just coming out now in so much research. There were some hero doctors 30 years ago that I followed, and that is how I was able to recover from MS. So we know that there are various different types of infections. Way back 30 years ago, they really thought a big part of it was fungus. And yes, fungus is a big part, and we definitely have to treat it. But what we've discovered is that in the last 5 years or so, that bacterial infections like Lyme disease are very often involved. And yes, we have to deal with those also. But why is it that most of the population is infected with Borrelia and the vector-borne infections associated with Lyme disease? Why is it that only 25% of people that are infected are showing symptoms of Lyme disease and most people are asymptomatic? Well, I believe that it has, yes, we have fungal overgrowth, but what we've seen in this last year is that people that suffer with MS are infested with worms, big ones and small ones. I did an amazing video a couple of weeks ago, maybe 3 or 4 weeks ago, and it's called MS and Parasitic Infections. I really would like you to go back later and watch that. And in that video, you're going to see real pictures of the big worms that our students are passing. They are up to 12 inches long. They're huge, they're disgusting, but they're so excited when they're coming out. And they have to come out because they are infecting us with other microbes. They are depositing all kinds of chemicals in us. They're causing inflammation. They are suppressing our immune system. And then there was this other really significant find that I came across earlier this year by Dr. Alan McDonald, who's sharing that he is finding these little parasitic nematodes in the central nervous system of every single person that has passed away, the samples that he's tested especially in the spinal fluid, but also in the brains of people that have died of multiple sclerosis. So he took 10 samples, 9 of them were from brain banks, and he found tons of these little nematodes, tiny little parasitic roundworms inside the spinal fluid. The significance of that is that when these roundworms infect the spinal fluid of domestic animals, they cause symptoms identical to multiple sclerosis. The spasticity, the balance issues, the blindness, the numbness, difficulty walking, drop foot, all of these different things are all linked to these nematodes being in animals. And they do know that these nematodes can be passed on to humans. You wonder why they never made that connection a few years ago. I don't know why, but the exciting thing is that we are discovering this, and some of my students have been using some of the anti-parasitic drugs, and it's been really helping. But our big dilemma is that we don't have, number one, our doctors cannot diagnose these infections properly at this time. It's not their fault. They don't have good tests. They will do a stool analysis and nothing will show up. You can do these wonderful comprehensive stool analysis for $500 and they won't show up. So they're not going to be prescribing anti-parasitic drugs. They're not going to treat them if they don't have any rationale. If they're like, you're clear, you don't have any parasites because it's not showing up in the test. It's irresponsible for them to just prescribe pharmaceuticals, right? They have to have a reason. So unfortunately, we do not have good tests. The doctors are not trained in parasites right now. They are not comfortable giving out anti-parasitic drugs. They're not used to, it's not a common thing that they're working with. And I don't know why, but over the years, they become less and less experienced in that. I know that in North America and all the different countries where we have, you know, where we have a very high standard of living, we assume that we don't get parasites. Those are just for third world countries. But the truth is that there are parasites all around us. Go out to eat in a restaurant, even if you're eating salad, somebody who has parasites, maybe they didn't wash their hands well, and you can get a parasite. You go shopping, the shopping carts, apparently 85% of them have fecal matter, parasites, bacteria, fungus. So dogs, cats, just opening the door, you can't avoid parasites. They're all around us. But why we're so impacted by them today is because many of us, including myself, I was on a lot of antibiotics, which really destroyed my natural balance, the natural defense I had, all those good microbes, wiped them out. And then we are a sitting duck and we are susceptible to parasitic infestations and fungal infestations and different types of bacterial infestations. So today we're going to be talking about how to treat these tiny little parasitic worms. And we're just going to talk about one aspect. It's an amazing study that I found. It was done in 2015, and it was looking at mice. All right. And so one thing I want you to understand is that when parasitic worms infest animals or humans, we end up with an increase in histamines. All right. So just the infection of the worms causes certain cells in our body to release histamine. And that starts the whole inflammatory process. Remember the inflammation associated with chronic disease. Well, this is one of the things that starts the inflammatory process. So when we are infected with these worms, and actually in the study, this 2015 study, they took two groups of mice and they infected them both with worms. And what they noticed is that when these mice were infected with worms, they had a much higher histamine level. And that was consistent throughout the whole time. Like, so it's not just something that peaks with infection and it stops. So they have a high histamine level. In the first group of mice, they gave them an antihistamine, which decreased their histamine load. The other group, they left it. And what they found is that throughout the 8 weeks that they measured, while they were giving this first group antihistamines and they've lowered the histamine load, they noticed that in those animals that they were able to, number one, the antibodies and the inflammatory response went down. But really big is that they noticed that their eosinophils went up 4 times. What are those? Those are the immune cells that we have that fight parasites, that destroy parasites. So both of these animals, when they're infected with worms and they have high histamine levels, their eosinophils are not increasing like they should. Our immune system is not going after those worms. If you followed my work, I've shared many times that Dr. Alex Vasquez, as dug through the research and has found that there are at least 17 different ways that different infectious agents, microbes, bacteria, fungi, parasites, can cause immune dysfunction in our body. So normally when you're infested with worms, you would think that your eosinophils would go up. It's like, send out that division, go and kill those worms, but they're not. So and what they found is that when you decrease the histamine, then there was a 4 times increase in the eosinophils. So what they noticed is that over the 8 weeks of giving that first group the antihistamines, there was a consistent reduction of the worm infestation week by week by week. And this was dependent on the eosinophils. It was the immune system of the animals that was clearing the worms. This is really significant because we don't have a really great way to treat these worms. We don't what would be nice is if we'd have a single treatment. And I know that if you go to, let's say, the drugstore and they're going to treat you or your children for pinworms, they want to give you a really high dose once and then a really high dose a few weeks later, and they think that'll treat it. And maybe for pinworms that's possible, but for these type of little nematodes that are getting into our central nervous system, we know that they are hiding under biofilms. The drugs can't reach them. They live for many, many weeks. This one species of small worm, it lives for 20 months at least, 20 weeks at least. So that's at least around 4.5 to 5 months that it lives. So just doing one shot of a drug is not going to clear them. It might give you a tiny bit of relief, but they will start growing again. They grow within several weeks and they mature, I think, around the 7 to 8 week margin. And then they just live as adults. So just by decreasing the histamine level, they were actually able to get the immune system to clear the worms by 50% in those mice. This is really, really huge. So what they're saying is that it's possible that using antihistamine therapy along with antiparasitic drugs and herbs, and we're using oxygen therapy. So in my program where we're helping the students to recover from these parasites, we are using things like herbs and herb blends, but sometimes we have to use antiparasitic drugs, which are prescribed by our healthcare providers. But there again, it's really tricky treating these because many of us have had infestations for years and they're very well rooted in our body. So this is one way that we could possibly layer on the use of antihistamines while we are treating the worms so that it will encourage our immune system to produce the eosinophils, the white blood cells that will go after the worms. So it's not just we're relying on drugs, but we're actually getting our immune system to play an active role. And that's really what we want because our immune system is amazing. It's a miracle. Our whole body, the way it operates, it's a total miracle. And so whatever we can do to support it to do its job is the best thing. And yes, there are adverse effects of antihistamines, but this is where you have to work with your healthcare provider. Remember, everything that I share with you is for educational purposes. So I'm not saying go out and buy antihistamines and start taking them. I'm saying that you need to work with someone. Antihistamines on their own is not going to clear the parasitic infestations. There are adverse effects of them. So you have to find the right one, you have to find the right amount, and you have to use it part of your comprehensive program to treat the infections. How do we do that? Number one, you have to stop feeding them. So we really greatly reduce the food. So you can go back and watch some of the videos that I've shared on what we eat or what I eat and what my students eat. I think I did a couple, like the eating plan, and then I think I did what I eat for breakfast, dinner, and lunch, or supper kind of thing. So number one, reduce the food to them. Number two, support the body, right? And so this is one way we can support the body is by decreasing the histamine level, but we do things like making sure that we do not have nutritional deficiencies and also making sure that we're having regular bowel movements and we're sleeping well. And I've done videos on all of that too. That's super important. Cleaning up the environment. There's lots of videos that I have out there. And then we have to treat the infections. It's so important to understand there is not a diet that will treat fungus and parasites, worms, big ones and small ones, or Lyme disease. There is no diet. If you follow the right eating plan, it is used to help you set the stage to treat those infections, but it will not treat the infections on its own. It's a very important part. And so it could be that antihistamines are going to play another important role. Going back to some of my other videos, I shared things like when we're treating the parasitic worms, it does sedate them a little bit. It makes them dopey, so they're easier to treat. And some of these neurologists are using, way back 30 years ago, Dr. Mass, the first neurologist I came across dealing with integrative healthcare, she was sharing that when her patients would go through a flare, they would use antihistamines to settle the flare. Think about it. If you've got these worms that are just like going crazy, the immune system is kind of like overwhelmed. And then if you dope them up, they're going to be less active. And then I shared on last week, I shared that study where they're seeing that giving people that have MS a certain antihistamine in higher amounts, that they actually saw myelin repair. There is no MS drug that does myelin repair. So there are many different aspects of how antihistamines can help us. They can dope up the different worms. They can help, and because you're slowing them down, that can help manage the symptoms. It can help us sleep because they won't be as active at night. But this whole new thing that I shared with you today is really super exciting. Could it be that using antihistamine therapy along with antiparasitic drugs, and remember that the drugs on their own are not enough. A lot of times in the program when I'm working with students is we're layering. They'll be using herbs and they may layer on a certain 1 or 2 pharmaceuticals like antiparasitic. Then they will also use oxygen therapies too. And when you do a combination of those, it's amazing. People just get their life back. And I just wanted to share, I was so incredibly touched today. Want to say hello to Mary. Mary's a student that just joined us today. And we have another student, Kim, who's going to be joining us also. And this is what Kim had to say. And this really warms my heart because all these Facebook Lives, if I know that you guys are getting something out of this and it's helping you, it just excites me so much. So what Kim shared with me, and I just chatted with her today, and she's going to be working with me in the Live Disease Free Academy. So she shared my vision so just by listening to the Facebook Lives that I have and the YouTube channel, she shared my vision has improved. So let me say, she listened to the videos and she implemented what she learned. My vision has improved. My brain is brighter. I'm sleeping through the night. I'm not getting up. My bladder I used to have to get up in the middle of the night because I had to have to go to the bathroom, but now my bladder is fine and I can sleep through the night. The spasticity in my right leg is much less frequent. And a big thing, the number one thing she said is that she used to have this anxiety vibration through her body, and it would be worse if she was ever triggered by stress. And following just the basic information that I have in the videos, she said that she doesn't have that anymore. So amazing. And the biggest thing for her was that she said, I have the most incredible feeling that there is hope. So the most incredible feeling is that I have hope and I know that I can get my life back because she listened to all my free stuff. She started implementing. She read my book, Become a Wellness Champion, started implementing, seeing that this does work. I'm starting to notice, and I haven't even started to kill the infections yet. So she's making them more quiet, but then she's very smart to understand I need to treat them. So that's why she's going to be working with us. So excited. We're just starting a new class. So I would really like to invite any of you that are at that place. You're like, thank you for all the free stuff, Pam. It has made a difference, but I want to plan. I want to end this year on a completely different note. I want to beat MS. I want to get on with my life next year. If that is you, make sure you watch my masterclass training, How to Recover from Multiple Sclerosis. And then if you're ready to go to work, then you can book a time to chat with me and you can start immediately. And I do know that I'm booked up for, I don't know, a week or 2, but if you can't find a spot, then reach out to us by email and I will definitely work you in earlier, all right? Because we always have things changing. We're dealing with a lot of sick people, so sometimes somebody has to miss an appointment and then I can work you in earlier. All right, so I'm just gonna go to your questions and your comments. This is a really huge finding, and I think it's gonna be super helpful for the students. Hello, Dawn and Troy. Hi, Troy. Hello, Zuditu. and Lynette. Hi, Danielle and Kelly. Hello, Mike and Allison and Mohammed and Catherine. Not a lot of questions yet. I know I'm trying to keep the science simple for you because yes, I know eosinophils, like what the heck are those? They are the little immune cells that are supposed to go after the worms. And if we can get our immune system to be producing them like they should, that is a really good thing. Hi, Tracy. Hello, Maureen. Hi, Chris. Hello, Tiffany. Hi, Roberta. And I don't see a lot of questions. Usually you guys have a ton of questions for me. Oh, here's a question. Hello, Judith. So as far as the treatments that I recommend you definitely can afford, definitely. If you are going to use antiparasitic drugs, those would be through prescription. But people that are on very low government financial aid and can't afford expensive vitamins, you don't have to. I don't say that you should use a lot of vitamins when you're recovering, because if you take a ton of vitamins, you're just feeding those parasites. But it does cost something to get better. And if you find that, and my heart goes out to you, if you're just living, like disability check to disability check, reach out. There are churches, there are volunteer organizations, there are GoFundMe, but you could go to a clinic which will cost you $30,000 to $80,000. That is not necessary. But things like, treating these infections, antihistamines are really not that expensive. Binders from the drugstore, the health food store, just a basic plant source vitamin mineral. And the herbs, they're not that expensive. But you are the only one who can change your life. You are the one who has to find the way. All right? Super important. Hey, Penny. Hello, Ruth. Your mom's name is spelled the same way. Awesome. So wondering, okay, that's just, hello, Jennifer and Stephen and Patty and Julia and Andrea. Not a lot of questions today. I think this is something that's pretty new to you. So Maureen, you bought extra strength Benadryl, trying that for now. All right, something until you become a wellness champion. So just to be aware, like the extra strength is not necessary. Like what Dr. Mass mentioned is that if you're going through an MS flare, then she would say take the higher amount of the antihistamine. Back in the day when I started, it was Polarmine, Polarine, something like that. But even just the bottle dose, and just make sure you check with your pharmacist too and your doctor if you're on any type of medication to make sure there's no interactions with things. So you have to be really safe. Hello, Patty and Sue. Hi, Kim and Judy. Tracy, what is the best antihistamine to try and start with? This is really new ground, Tracy. Back in the day, like 29 years ago, when I came across the neurologist, Dr. Mass, I started with Polarmine. And now it is not available in Canada. It's not available. I don't think it's available in the US. It's hard to find. And I don't know why. But what you can do, what I'm seeing, because just even in the last video that I did last week, people were sharing with me that when they're getting their infusion of Ocrevus or Tysabri, some of those really strong, toxic MS drugs, the doctors are giving them a big shot of Benadryl before. So it could be as simple as Benadryl. I know that in this study, I don't know where I put the study, but it is just, oh, here it is. It is fexofenadrin, Fexofenadrin. But remember, that was this is a mice study. I would personally just use Benadryl. The key, what I'm seeing with the antihistamines being helpful, it just has to be, it's called an histamine 1 receptor blocker. So it's blocking the histamine 1 receptor. So there's different types of histamines out there, and you're just looking for something that is blocking the histamine 1 receptor. But it could just be that Benadryl will help you. I know some of my students are just starting with Benadryl. in the program, like they're starting to, build the game plan to treat the infections, and they are just incorporating Benadryl, and they're finding that they're sleeping better already. So this student Kim, who's going to be a student right away, because she just talked to me just a couple hours ago, she was not even using Benadryl, but she was just implementing, just changing her eating plan. So that's, Judith, that's what I would do if I were you, is I just start to implement what is out there free, read my book, and reach out for help. Reach out for somebody to help you financially. That is super important. And then you know what? When you get better, you can help someone else. That is it. Pay it forward. Hello, Pamela, and Gabby, and Judy. Hi, Carrie Allen. You're from Calgary. Hello, Calgary. And Lisa. Is this common knowledge that your neurologist? No, your neurologist should know this. So what my students are doing is that they're working with neurologists. So the neurologist is just testing them along the way. So as they're improving, they're just testing them, and eventually they're coming off their medication. And then the neurologist will say, you've been off your meds for a year, you're passing all your tests, you don't need to come back unless you need us. There are a small number of neurologists that are really excited about all of this new research, and they're open to it. And then there are other ones that are just like, nope, don't want to hear about it, don't care, doesn't. And this is where, when you're working with them, all you need from your doctor is that they are going to be respectful and that they are going to support you. They don't have to believe in it. But if they're open, give them the research. I have all the research put together on a page. It is on my website, livediseasefree.com, livediseasefree.com/MS-infections, MS-infections with an S at the end. And you will see the research from Dr. Alan McDonald there. They can actually look it up. Will they look it up? You have to understand where they're coming from. They have gone to school for many, many years and been taught that they are the experts in the world, that MS medication is the only answer. There is nothing else. So they really believe in their heart that that is the case. And it really is only doctors that they themselves get sick or their family members get sick and they say, I don't like this, the prognosis, where it's going to go. Let's look somewhere else. So you have to remember, they're super busy. They've got lots and lots of patients. They've got busy lives. They're not going to research into this new way unless they are spurred to do so with something. And whether it's them sick or a loved one sick. And there's a small group that are real forward thinkers, and they will definitely be researching, like if they're maybe in a university and they're research. So there are some neurologists that are researching the microbiome in MS patients. The MS Society invested $28 million a couple of years ago into researching the different types of microbes that are out of balance with MS. It is coming, but you have to decide if you want to wait. It could take 10 years before this is mainstream. I'm trying to push it more. We have many students that are recovering. And so you have to decide, do I want to stay on this path where the prognosis is continual disability with or without the drugs, right? And then extended care facilities eventually. Or do I want to stop these infections and get as much recovery as I can and get on with my life, right? And that's where the people that I attract are the wellness champions, and they are doing that. So just remember, Judith, make sure to reach out. There are people that have money that want to support you, but you have to ask. You have to be out there and you have to ask for it, and they will support you, and then you can bless somebody else in the future. All right, so how do I get a doctor to prescribe the parasitic drugs? That is a really good question. So what we're doing with our students is that I actually, in my members area, I've created documents how to find a healthcare provider, how to work with a healthcare provider. And I basically, excuse me, too much talking today. Basically, you have to find a doctor that can do like advanced muscle testing. And that's what I teach my students, because They cannot find these parasites with a stool sample. They won't, they're not looking for it. They're so small, usually they don't even find the big ones, and the big ones we have to clear too, but they're missing the big ones. The little ones, they're not even looking for. They have to look under a microscope. So our traditional GPs and medically trained doctors will not be able to help you. I mean, it would have to be somebody who looks at the research, looks at your symptoms, is incredibly forward thinking and says, okay, let's try this. But that's pretty rare. So my students are looking for integrative healthcare professionals that know how to do advanced muscle testing. So they will have samples of these various antiparasitic drugs in their office, and they will do advanced muscle testing. And so they'll hold the drug up to you and go, okay, yep, that one opens regulation. Nope, that one blocks. Okay, your body doesn't want it wants this one. And so in our program, we have, like, you can't just go and be treated for parasites. Those days are over. Like, just to go and take a drug, they are stealth organisms. They are deep-rooted in your body. You have to do all the steps. You got to stop feeding them. You got to support your body. You have to understand what biofilms are. You have to be eliminating. So when you do all those things, you will recover. If you just want to go and get a drug to treat parasites, I have this beautiful student in Europe. She's a medical student, and she knows about these. She's sent me pictures of these nematodes in her blood. And I can't show you guys yet because she is going to do a study. And as soon as her study is ready, it'll be early next year, I will be promoting her work like crazy. So she's the one that spurred Dr. Alan McDonald to look for nematodes in multiple sclerosis. Because she said to him, she said, we're finding nematodes in the blood of people with MS. Could you check to see in the central nervous system if they're in there? And he did, and they are. So what happens is these are, remember, there's Lyme, there's fungus, but we're just talking about those little nematodes. They are passed on through vector-borne infection. They're a vector-borne infection. So the little worms are passed on through mosquitoes, through ticks. So it's not just the Lyme. And you could just even have a mosquito bite, and it plants the larva, like the immature form, in you. And then it has a specific life cycle. I think it goes into the lungs or lung area, or sometimes in the gut, depending on the species. And then it finds its way into the blood. And so this is what the student found. And so she's a medical student. So she's like, I'm just going to hit it. So she's hitting parasites, she's hitting fungus and hitting Lyme, antibiotics, and just hitting them and hitting them and hitting them. And she is staying out of the wheelchair, but she doesn't feel well. And she's like, I have to do something different because this is not working. And so that is why we are leaders in this area of understanding how you have to use an integrative approach. So I do study under the hero doctors, like Dr. Klinghardt, for example, Dr. Vasquez. There are a handful of doctors that really understand infections, and they're light years ahead of everyone. So if you want to get well, you have to go where they are having the success. So Gail, can someone who has a gastric bypass surgery follow your plan? Absolutely. You have to follow the plan because it will save your life. Absolutely. It's not an MS or disease-specific program. So Pamela, it's complicated. You really have to, what my students do, and this is the best way, is that you learn what you need to do to recover. You can do 90% of this yourself. You might need a healthcare provider to prescribe if you want, right? If you use the herbs and you're using the oxygen, you've come really far, but you're like, I want to see if I can just nail it harder, and using the drugs towards the end or mixing them. At that point, you've done so much yourself, you're so much better, then you know how to go and find the right person. And we literally have to give them the research. We have to give them our symptoms. We have to give them the protocols, and then they can test. And then they're comfortable prescribing. And then they can monitor, like, because you're going to be taking it for a while, taking breaks. You may have to switch. There are different types of antiparasitic drugs that will, some of them will just touch the GI tract and they won't go out into our blood and into our central nervous system. Some of them will go into our blood and central nervous system, but we have to be careful we don't kill the worms too quickly, because we could have a detox reaction in our central nervous system, which could be fatal. So there's a lot to this. I wish there wasn't. If there wasn't, I would write a book and everybody would be cured. I wish that was the case, but it's not, unfortunately. And hopefully in 5 years or so, we will really understand, easier and better ways to help the majority of people quicker. But right now, we are still recovering in months, not years, which is so amazing. So if you're at that place where you are ready, you're like, Pam, I love all your stuff. It's really helping me, but I want to get better. I want the step-by-step plan. I want you to guide me through the process. I want to be passing those big, disgusting worms. I want to kill those little nematodes and knock back the fungus and deal with Lyme if I have it. I want to learn how to take care of myself for the rest of my life, and I want to get on with my life. That's what I can help you to do. Make sure to watch my masterclass training. Reach out to me if you're ready, only if you're ready. And I am so excited to support you. And this is going to be the best end of the year that you've had in a long, long time, the best Christmas present you've had in many, many years. Hi, Roberta. Dark in the house. I'm not sure what happened. Maybe no electricity. I'm not sure. Hi, Lori and Patricia. Hi, Carrie Allen. So do you imply that all MS patients have worms or majority? And is it one issue combined with others? Yes. What I have seen this year in the students, we finally figured out how to get these parasitic worms moving out, is that it's more the norm that people with multiple sclerosis are infested with big worms. And because of the nematode connection, that little tiny, the microscopic ones, linked with animals, and how it's exactly the same symptoms, and how Dr. Allen's found it in every single brain and spinal fluid specimen that he looked at. Yes, I believe that for sure we all have fungal overgrowth, and fungus gives us lots of symptoms. We also have these little parasitic worms in the central nervous system, the majority of us do. And we also are infested with large parasites. And we can also have varying degrees of Lyme disease, because remember the tiny little worms, the microscopic, they're called micro roundworms, nematodes, they carry Lyme disease. And when they move into our central nervous system, they deposit the vector-borne infections, the Borrelia, etc., into our nervous system, into the brain and spinal fluid. So MS is a syndrome of multiple infections, and that's why there's never going to be a single cure. But the neat thing is, when you treat these infections using a lot of strategy, using a step-by-step approach, you can't clear the fungus or the Lyme if you have a lot of bigger parasites, especially if they keep reinfecting you. Think about a 12-inch worm, right? When it poops inside of us, it is depositing bacteria and fungus and other small parasites. And we know that the big worms, they produce things like ammonia and amphetamines and morphine-like substances. And we know fungus can produce 70 different poisons. So MS is a syndrome of multiple infections, a lot of inflammation from those infections, a lot of chemicals produced by those infections, which is making us have brain fog, destroying our memory, making us all depressed and super anxious, terrible anxiety. And when you start to clean up the poisons, start to treat the infections, you get your life back. You will have a lot of improvement with mobility and with the MS symptoms, and the disease will stop and you'll get your life back. All right, so Lori, hello. Hi, Carol. Great question. Hi, Michelle. Do I recommend certain herbs on a case-by-case basis? Yes, and that's why I can't recommend anything on these calls. It's not that I'm withholding something from you, but it's like, it isn't a cookie cutter. It's not exactly the same for everyone. There are some people that cannot handle herb blends. They have a lot of immune dysfunction. They are very sensitive to things. So they have to start with, what we're starting to do now is we're starting to clear some of the parasites out of the large colon, and then they can handle the herbs better. Or maybe some people want to start with single herbs, right? Because it's just easier. Some people want to start with the antiparasitic drugs. It depends what medications you're on. It depends on the symptoms. It depends on which of the groups of infections are in the forefront. So someone with MS and cancer may have a lot more fungus up front. And when you knock that back first, they are at less risk for cancer, and then they can treat other things easier. We generally do treat parasites first, but some people do like to knock back fungus a little bit. Sometimes there's overlap. Some of the antifungal natural things we use, will also knock back bad bacteria like the Borrelia, etc. So remember, you guys have probably seen research about well, we know Clostridium can be a problem too, but the pneumoniae, chlamydia pneumoniae, that's the one. That is another one that's been implicated with MS. So there are multiple bacterial infections, fungal infections. It's not just Candida. We're seeing Aspergillus. We're seeing different types of molds, and also the parasites. But if you don't treat the parasites, which are bigger, they are infecting us. They are suppressing our immune system. They keep reinfecting us with different microbes. So it's really important to understand all of that, because then you get better quicker. And that's my goal, is to help people get better quicker. Lisa, do you have your talk available to read as well? Oh, that's a really good question. I have been working on it, but I don't have it right now. I promise you I will make a note to do that, because I know that there are some hearing impaired, and I did have it typed up, but I don't have it right now typed up. There could be some of my older training videos where I know there's closed caption where you can listen to it, but it's not typed up yet. There are a lot of things I have to do. I'm getting more and more help. We're growing so much. We're in 12 countries now, just scratching the surface. We want to bring change. We want this to end. So Lynette, how long do I take the antihistamine for? This is where I cannot prescribe for you. I'm not a doctor. This is where you need to work with someone. We're using it for specific reasons. What Dr. Mass would say with her patients is that if they were she taught them how to use it properly. And if they were having a flare, they would take the higher amount of it until the flare settled down. And then she would get them to avoid all caffeine. And she would make sure to avoid triggers like food sensitivity things, and cocoa, like all the caffeine. And then people would just use it as needed. But remember, it is not treating the infections. It's just something to help you manage the symptoms. But possibly, according to this talk that I did today, it's more than just managing the symptoms. It could also help to get the immune system to be in the battle for our recovery, right? By producing the right immune cells that are going to go after those parasites. Where to buy the book? Amazon, Barnes and Noble, Carrie Allen. So that is just Become a Wellness Champion. You'll see it on Amazon or Barnes and Noble. And then the neurologists sell drugs. Unfortunately, yes, they do. When you've been sick for a while, you really come to understand that they are experts in pharmaceuticals. And I'm not against pharmaceuticals. We need them for certain things. So sometimes they're really helpful to clear some of these parasites. But I'm just not for living on disease-modifying drugs forever, because they do not stop the progression. People still move from relapsing remitting to progressive. They do not treat the cause. They have horrible adverse effects. We could end up, you know what the adverse effects are. I'm not even going to talk about them. So unfortunately at this time, our medically trained experts, they are experts in medicine alone. But there are a growing number of them that are really excited about this, and they're starting to research, and they're super excited about it, but they're not easy to find yet. And they still don't have the experience, but it'll come. If I have anything to do with it, I will be, and I'm going to a big workshop in November. It's an integrative, so probably not a lot of neurologists there, but I will be networking like crazy. So how do you find a non-brainwashed neurologist? You just literally have to kind of talk to their intake nurse first and just say, is this doctor open to integrative health? Remember that you have to learn this. If you just go to somebody who's open, he'll be like, I don't know what to do, right? And so you have to learn this yourself. And then even if they are not going to learn this, because it's just like telling an electrician, you've got to learn plumbing. And they go like, no, I want it to be an electrician. I don't want to be a plumber. So maybe the neurologist wants to work in medicine and he doesn't want to work in integrative health. But if he can just monitor you, like just check you, like doing the different types of testing that they do as you're improving, that's all you're asking for. And just not to be super negative, right? Just to be supportive, but to be positive when you're improving and you're getting your life back. And Catherine, you're taking Claritin daily. this is where, you know, I'm not saying you should take that. I've heard with Benadryl that they are giving, you know, if they're, for example, if they're giving MS patients a big shot of a very strong drug like Ocrevus or Tysabri, they are giving them a shot of Benadryl. I can't say Claritin daily. Listen to your body, talk to your pharmacist, talk to your doctor, learn this stuff and get better, right? Another great question. So Elsie, you take a certain, it is an antihistamine. So if it's helping you, I'm not sure, is it helping you? So you're taking an antihistamine daily. So Tiffany, you ordered my book through Barnes and Nobles. And Adele, how much does it cost to join? Sorry to be so blunt, but you're on disability. So just reach out to us. Like, what I first want to do is I want you to first see what we're doing, right? And if you're on disability, I have a couple of different options that I can help support you. One is more full support and one is more self-directed. So reach out to us and I'll share all the details about that with you for sure. Hello, Carol. Hi, Chris. Can we order antihistamine from an online pharmacy? You can look for Polaramine. That's what I used in the past, but a lot of people are saying they're having a hard time finding it. It's not to say that is the only or best one. That's just what I used because that's what Dr. Mass said. And she said to, you know, start low and slow. It comes in 2 milligram tablets and you would take 2 milligrams. Can you handle it? It doesn't make you too tired. Twice a day. I think it lasts for 12 hours. I know different antihistamines last for different amounts of time in the body, but I believe that was just twice a day. And increasing it up to 6 milligrams twice a day as tolerated, working with your doctor when you're dealing with a flare. So when I was first really sick with MS, I felt super hyper, like I had terrible insomnia, I couldn't sleep, I had severe optic neuritis, so I was totally exhausted but wired. And when I took the antihistamine, it really brought me down to a peaceful level. And I could sleep through the night and I started to heal. I then started to, you know, learn about treating infections and doing everything that I'm doing. And that's what I focused on. I kind of dropped the antihistamine. So all these years, my mom was always like, you've got to tell them about antihistamines. It's so important. I'm like, Mom, it was just to help people sleep. But now when you go through the series that I've done on antihistamines, you really see that there is more than it's just sedating us. It's sedating the cause, some of the cause, the worms, and it possibly is helping our immune system to increase the eosinophil level, to the immune system to fight the parasites itself. So remember, if you're taking it for a week or so, it's not going to increase the immune cells quickly. It was week by week over 8 weeks, the eosinophil level increased 4 times. So they were able to clear the parasitic infestation of these tiny little microscopic roundworms by 50%. And that was just the immune system, not even using any drugs. So this is huge. All right. Here we go. So I'll just finish up here, wrap up the last few. Dawn, you're still working through the Live Disease-Free Action Plan. Awesome. I know it takes time to work through it, even when you go through it. I have people that have finished even the academy and they're still working at it. When you're treating these parasites, it can take 12 to 18 to 24 months. Remember that this one type of parasite I was talking about, it lives for at least 20 weeks, at least 4.5 to 5 months. And there's bigger worms, right, that will live for months and months. So, and they're hiding, and there's different immature forms that can stay dormant for a while. That's why it takes cycling. Even when you're feeling like you're recovered, you have to cycle through the treatments a few times. I would say at least 12 months of treatments, if not longer, depending on how long you've been sick, right? And you're listening to your body, etc., for sure. You have a question about starting to pass those ugly worms. So Dawn, if you're in the action plan, we do have the call. So make sure to send in your question to the call, or yes, you can send me the email for sure. So Catherine, you're exhausted. You said you're exhausted listening to everything that you have to do to get well. And that is true. Most people don't figure this out, Catherine. That's the honest truth. I've been on this journey for 29 years. on researching, I have a science degree. So you can either continue down the path you're on and it's brutal, or you can reach out and you can follow a step-by-step plan where you don't have to do everything at once. We start with the eating plan. You take a good week or more going through it and following it really well, and I check your work. Then we go to supporting the body, and it's a little checklist. It's okay, do this first, check it off, the next thing, and going through that. Then we look at your symptoms and we see, okay, what type of infections do you have? And then we start to build a game plan. And throughout the whole process, I'm looking over your shoulder and I'm guiding you through the process. And that's through the academy. So it is too hard to do it by yourself. So that's why you need to reach out. And you can either go to a really good clinic where they treat infections, but it's super expensive. Like we're talking $30,000 to $80,000. It's not uncommon to have $5,000 to $10,000 on tests done, and you, in my humble opinion, they're not necessary, right? If you have the symptoms and you start treating and you're improving, and you can work with somebody who does this advanced muscle testing, if you want to use the antiparasitic drugs, much simpler, right? We're trying to make this it as simple as possible, but it is step by step by step. Hello, Elizabeth and Val. I know, Elizabeth, I want you to listen to the grad support call, because I know you can do some more work with what I've shared on there. You'll love it. And I just did that on Monday this week. So Val, you would like, sorry, there's some things here. You would like to watch this, but you have a previous commitment. There is a replay, Val. You can listen to the replay. Thank you so much for your kind words, Tiffany. It was such an honor and privilege to support you. So Carrie Allen, you're wondering, do we need to assume immediately that we have parasites, or is it a possibility? As soon as you fill out my assessment forms, if you've got a bunch of symptoms, there are specific symptoms for parasites. If you have a bunch of them, you can assume that you have them, and then you can start treating them. And you don't need a doctor to start treating them. We generally, it's just step by step, right? And it's all laid out in the program. So what do you think about Botox for spasticity? Catherine is wondering. Botox is a neurotoxin. So you've got these nerves that are so irritated from the infections, and it's causing your leg to become like a permanent Charlie horse, right? That's what spasticity is. It's so incredibly painful. It's like a total contraction, constant contraction. When you put a neurotoxin in to kind of numb or poison the nerve, does that make sense? Right? It's like it's already suffering like crazy. Why not treat the infections? And what we see is the spasticity goes away. When you treat the infections, the spasticity goes away. There are students that have been on baclofen pumps that are not on baclofen pumps because their legs are, one student said, my legs are like noodles. They're so soft now. And yes, those people, they have to start working their leg muscles because they haven't walked for a long time. But the key is that the spasticity is a symptom of the infections that you're dealing with, damage from the infections. A lot of that can be reversed. We see spasticity can be reversed. That's something that can. I can never promise full recovery, but we see balance comes back. We see spasticity goes away. We see that people get more strength in their legs. We see that people can handwrite again. Tremors will go away in speech. Tremors with arms and the head tremors. Vision can improve. So there's a lot of improvement that you can have. You just support the body so it can do as far as it can go. So Lori Martin, you had 1 parasite, 3 in a row gross. Wow, that's amazing. So Lori is a brand new student and she's just starting. Way to go, Lori. High five. Awesome. And yeah, I can't wait where you'll be at by Christmas time. And I just want to say a big shout out to Lori. Lori is somebody who just joined the program. She had a huge crisis in her life. And sometimes, you do this for yourself, you join the program, you're ready to take your life back, and then all of a sudden your world falls apart. And you just want to crawl up in a ball and you just want to just give up, right? But Lori said, no, I have to do this for myself. So she pulled enough strength together to stick with the program, to start it. And she's been with it for like a couple of weeks, maybe 3 or 4 weeks. She found me a couple of weeks early, but she's already had a lot of symptom improvement, and she hasn't even started treating infections. Obviously, she's starting to pass the worms, as she shared. Thank you so much for sharing that. But I just want to say, you guys are my heroes. You are the trailblazers. You are the leaders. You are the forward thinkers. You are like, no, I want my life back. I'm going to take my life back. And those are the people that I work with. And you are helping us to bring change. You are doing it. It's not me. I can't do this by myself. It is that you have the fortitude and the strength and the courage to take the steps to take back your life. And then people behind you are like, oh my gosh, if she can do it, I can do it. And that's how we're going to make this thing change. That's the only way it's going to change. So I just want to say you guys are my heroes, because there are some wellness champions listening right now. All right. Hello, Pam. You just found me the other day. You're 25 years old, and you just wanted to say that I gave you hope. I am so thankful for that. And please watch all my videos as fast as you can. Reach out to me, get started, take your life back, and then help us to bring change. Hello, Calvin. And hello, Penny. And Melissa. Hi, Melissa. I think you are the wellness champion who is starting a food company. So exciting. I want to hear about that. You sent me an update a while ago, but I'd love to hear how that's going. So she's somebody who has an amazing story, who had to relearn how to walk after a really bad attack. By the time she was done the program, she was back to work after 10 years. And I had an update from her just this summer where she said she's starting a health food company. So incredibly proud of her. So it's really neat to hear students that I've worked with a few years ago and just what they're doing with their life. So hello, Julie. Make sure you listen to the replay. I shared a lot of good stuff. And Deb, you just ordered my book from Amazon. So how do I get in on this action plan and discuss this? So Carrie Allen, watch my masterclass training. I'm going to wrap this up in 2 minutes here. Watch my masterclass training. If you are ready to invest in your health, then you can chat with me about this academy. But we can support you in different ways, but that talk with me is for the academy. So just make sure that you reach out to me. And Michelle, you have a theory about why women are more susceptible than men. You read an article that said women have certain protein that opens up the blood-brain barrier. You also believe women's gut health is more sensitive. You know, there's a lot of theories out there. I think it has a lot to do with our hormones because, for example, when we have fluctuations in our hormones, like 2 weeks before our menses, we have a higher progesterone. And with the higher progesterone, our blood sugar level is higher. The inflammatory, the fighting response is suppressed. So during that time, the infections are more active and we get all these PMS symptoms. And when we're pregnant, right, we have high progesterone. And during that time, we have 9 months of the bugs growing and being happier. I really think it has a lot to do with our hormones, the changes in our hormones, for sure. Hello, Claudia. All right, so you're so excited about this, Carol. You're so very welcome. It is life-changing. This is just the start. I have so many amazing videos on YouTube. If you've never met me before, I'll just wrap this up now. So if you haven't met me before, if this is your first introduction, watch all my stuff. Those are the best people that I talk to. Listen to my masterclass training, How to Recover from MS Naturally. Watch all my free videos. I promise you there are golden, life-changing nuggets in every single video. Kim is a living proof of it. It has already started to change her life, and it's given her so much hope. And now she's going to go for it. She's going to finish this job off and treat those infections. And so then, you know, if you're at that place, reach out to me, have a chat with me, and get started. You can get started right away. And in 3 months, you will be at a whole different place with your life. You will get your life back. Will you be totally cured? Probably not, but you will have a lot of recovery. You will feel so confident and you will be well on your way. There are a small number of people that are pretty much symptom-free. Most of them are, it takes them a few more months, but the exciting thing is that you've had so much improvement that you feel confident, you know that you are going to continue down the same path and finish the job. Remember, it takes 12 to 18 to 24 months to cycle through and treat them, but at least then you'll know how to do it. For the rest of your life, you'll manage them. There are a lot more comments. I'm going to have to stop there. I'm going to let you guys go for now, so make sure to reach out to me. Our class is starting. This is the orientation week, and we will be working hard for the next 3 months together, and I'm super excited if you're ready. Next week, I'll be talking about how to prevent getting the flu naturally. And for a lot of us, that's super important because we're heading into flu season. So with that, I'm going to let you guys go, and we will see you same place, same time next week. Take care and bye-bye for now.